Good afternoon, everyone. My name is Edwin Odell. Welcome. I'll be your host and moderator for this very interesting webinar. We're here today to discuss depression and how Albizu University can help you. Across the nation and in our own backyards, we're experiencing devastating depressions. Depressions brought on by the pandemic and isolation. Our first panelist is Professor Scott Hyman, PhD. He's a doctoral clinical psychology program professor at Albizu and a licensed psychologist. Would you give us an idea what you think is going on with all of us? Dr. Hyman?
Yes. I mean, it seems that, overall people have been more stressed, it's not just one single factor, you're not talking about, we're always kind of looking at things in terms of being multivariate. And I think when you have, the current political climate, you have the COVID situation, and you have just, the daily stressors of normal life that people are experiencing. I think, I don't know if people have forgotten, but, even before COVID, almost, regularly you were hearing about even, the school shootings. And that seemed to kind of take a back seat to all the other things that have been stressing out, people all over the United States. So I think, just people don't seem to be able to get a break, so to speak. And when you're talking about stressors that are chronic, ongoing stressors where people don't believe that there is much relief in sight, that kind of uncontrollability really weighs on people. And when people are overwhelmed with stress, it seems to affect their ability to think clearly. It affects their decision-making. It makes people more impulsive. It can oftentimes lead people to want to seek out rewarding type things that they find through smoking, drinking, unhealthy foods. So, not only does stress start to really affect people and could actually potentiate and develop into mental health disorders like depression, as you were mentioning, is one of the possible dire outcomes and all that goes along with that. But on top of that is that people start to engage in a lot of unhealthy habits. And that just really compounds the problem. And it makes sense. People want to, seek out rewards to make them feel better. And so they turn to things that give them that immediate relief. But oftentimes those things lead to longer term health consequences.
Thank you. We're going to get back to some more about you with the tips. We're going to go to our next panelist. Let's welcome Professor Emily Lescano of Albizu's undergraduate psychology and education program. She is also a licensed mental health counselor with a private practice in Miami and serves as program director of the Miami Mental Health Awareness Initiative. Ms. Lescano has over 10 years of experience in the infant mental health field and early childhood development disorders. Her focus today will be on avoiding COVID-19 burnout and compassion fatigue. Would you give us a few quick words of introduction there?
Yes, Adele. I mean, with everything that has happened, we're living unprecedented times, like Dr. Hyman said, and there's been an accumulation also of stress through other circumstances prior to the pandemic. So if you think about all the different changes our families, have to go through adjusting to the pandemic, having the kids home, having to work from home as well. Some people were not really familiar with technology. And the fact that you're dealing with the family home, that you're working from home, and some of us feel very grateful to be able to work from home. Others have lost their jobs and they're going through financial struggles. All of that adds to burnout symptoms. When we think of burnout, think about a physical state of emotional and mental exhaustion caused by the long-term involvement in emotionally and demanding situations. So think about, for example, for those of us who are very grateful having a job, for example, and you're working from home, you're juggling with the family and the kids. A lot of the burnout symptoms you see, for example, translating to that compulsion to prove yourself, that you can deal with all these different demands, working harder, neglecting your own needs. Also seeing symptoms of depression, like Dr. Hyman was mentioning, having other type of symptoms that translate to other domains, such as physically feeling muscle tension, having sleeping issues, having cardiac symptoms, for example, or even digestive symptoms, hypertension, you name it. You also see symptoms related to emotionally, anxiety, irritability. So some people do not recognize that you're building out these burnout symptoms, and it translates not only to your professional relationships, but also to your family and your intimate relationships.
Thank you very much. We're going to come back to all of you for tips, excuse me, later on. Next, we have Professor Isaac Turgeman, PhD, Dr. Turgeman. Dr. T, as he's known by many of his colleagues, is a Clin Pharm assistant professor at Albizu's doctoral psychology program. He also serves as co-coordinator of the neuropsychology track, faculty advisor for the Neuropsychology Club at Albizu, and as an adjunct professor from the Masters in Speech Pathology program. Dr. T has participated in multiple conferences and co-authored many book chapters and publications throughout his career. His focus today will be when to seek professional help from a mental health professional. So we're going to go to Dr. T and let you know that we're going to take the first 15 minutes. We're going to take the last 15 minutes of this, I'm sorry, and we're going to come back for your questions. So if you have any questions as you listen to our panelists, please put them in the chat box and someone will read them later. So when do we seek professional, Dr. T?
All right, well, good afternoon. Thank you for inviting me to be part of this panel. As the other panelists have mentioned, there's a lot of stressors that are currently all around us with the political status that Dr. Hyman mentioned, the ongoing pandemic, as well as pre-existing factors that we were all dealing with. Dr. Hyman mentioned the school shootings. Dr. Lizcano made reference to other societal and social components as well. So I think it's very important to first start off by saying that a stress reaction is normal. We experience stress in our everyday lives, and that's part of our normal reaction to different things that occur around us. So just simply experiencing stress is not the issue. It's how intense and for how long we experience it. So when we're talking about when to seek help, it's more about how long have you been having these symptoms. As was mentioned by the other panelists, sleep changes. If you see yourself struggling to fall or stay asleep, but it's not just one night or 2 nights, but now it's going on for a significant period of time, that may be an issue. If you experience changes in appetite that lead to either weight loss or weight gain, and again, it becomes an ongoing trend, that is also a significant issue. Sadness, frustration, irritability, or just simply worrying. These are normal emotions and reactions, but it's the intensity. So again, if you see yourself struggling with sadness or depressed mood and it's going on for 1, 2, 3 weeks, that becomes a significant issue. If you find yourself worrying and can't go on to do other things, it's impacting you socially, in your work, in your school, that is also a concern. So when you see yourself having these symptoms and they're prolonged, it's good to talk to your family doctor, or if you have seen a specialist before, such as a psychologist, neurologist, or psychiatrist, or any other mental health practitioner, it may be also a good time to follow up and just inform them about what's going on.
Very good. Now, that's interesting from the standpoint of when, but what are some of the tips that all of you talk about this, from burnout to whatever you're facing? Dr. Hyman, what are some of the tips that people might use to try to relieve this stress, this burnout, and all of the things that you've all talked about, fatigue?
Yeah, I mean, the way I like to think of it is kind of like what can you do in the moment to deal with a stressor when it hits? But I also kind of like to think about and talk about, what you can start doing now on an ongoing basis that actually starts to train your brain, and it actually trains your body to be able to be more, less reactive to stress when it actually happens. So, just creating a schedule where, for example, you go to sleep at the same time and try to make sure you get a good night's sleep, eating a healthy diet on a regular basis, getting exercise on a regular basis, practicing anything that you find enjoyable or meaningful in your life, like being creative, engaging in, musical endeavors, whatever it is that you like that actually kind of gives your life some level of pleasure. Even just taking a simple walk on a regular basis can actually release, feel good neurotransmitters in the brain that actually can have a antidepressant effect. So, if people have heard of mindfulness meditation, mindfulness meditation has been shown actually in many studies to actually reduce a person's stress hormone, which is called cortisol. And so the idea is that, if you kind of create a schedule where you could practice some level of mindfulness meditation, maybe a couple of times a day, throughout the day on a regular basis, that can actually start to help you bring down your baseline level of stress reactivity, so that when you're facing a stressor, you won't be as reactive, and you'll be able to then think through and come up with a better action plan on what you can do to deal with the problem. So then it's about, okay, well, what do you do actually when the stressor happens? So if you do that training piece, it's going to make things better when you're actually facing the stressor. But then it's more about, okay, well, you want to have like a variety of techniques, because, one technique is not going to be very effective in a particular situation. So like if you're in a meeting with your boss and you're not happy with something that he or she says to you, I mean, that's not the time to start getting into practicing yoga or something like that, or, or start doing some sort of exercise, because it's not the right opportunity. When you're driving in a car, it's not the right time to really start to practice some level of what we call maybe progressive muscle relaxation. So these are times when you can maybe engage in some sort of cognitive strategies. So cognitive strategies have to do with, one, changing the content of your thinking, maybe kind of slowing down and thinking to whether this is really as bad as you think as it is. Is it as bad as I think it is? Is there another way to kind of think about this situation? And hopefully that kind of reappraisal process can help you change your stress response or your mood state in that moment. Other things that you can do are just simple distraction, get out of the situation, go for a walk, get out of your head for a minute. Sometimes that's just enough to kind of get you out of that cycle of rumination and worry that can actually, is like negative repetitive thinking that can make your feelings of stress even worse than they really need to be. And then there's a really interesting technique that I personally use all the time, and I find it very helpful, which is called cognitive diffusion. And really the spirit of this is to kind of start to distance and disentangle yourself from your own thinking. And some things, it's almost like you're kind of watching your thoughts almost like they're an external entity. And you say things to yourself like, yes, this is too hard, but you know what, I'm just having the thought that this is too hard. Or to say, thank you, mind, for that thought, but I'm going to still focus on what I need to do to get out of this situation the best way possible. So you kind of like let those thoughts kind of come and go. You tell yourself that, yeah, you're having a thought, but it might not be as bad as you think it is. And maybe there's another way of thinking about this situation. So it's either cognitive change or use some sort of cognitive diffusion. I think it's good for people to have a variety of strategies, because it's almost like having multiple offenses, and, we can all score touchdowns, but they're just different ways of getting there.
Right. Professor Lascano, I know you're talking about COVID burnout and compassion fatigue. Is there a difference? And is there anything I can do to help myself if I'm facing this?
The difference between burnout and compassion fatigue, basically a burnout, it's more of a general situation where compassion fatigue, it's something that builds over time. And oftentimes we see compassion fatigue, for example, in human services professionals. So we see it in nurses, we see it in teachers, we see it in mental health professionals, and it has to do basically with the individual being exposed for a prolonged period of time, where they are exposed to patient experiences of other individual experiences, where they have to constantly be combining the empathy for their patients, and they have to be providing care for their patients. But we could also see it even in a person who not necessarily is in the human services profession, but is a caregiver, somebody that perhaps been ill for a prolonged period of time. And when this person is constantly caring for this person to the point of neglecting their own needs, it results in compassion fatigue and some of the symptoms that I mentioned earlier. So what we can do is a lot of the techniques that Dr. Hyman mentioned works. For example, putting the oxygen mask on yourself, taking care of yourself first so you're able to help others. For example, he was talking about cognitive strategies such as that monitoring that self-talk, being kind to oneself rather than, being harsh on yourself. Seeing that your experiences in relation now to what we're going through to the pandemic, it's part of a larger human experiences, and that you're not isolated in this situation. Holding, one's painful thoughts and feelings in balance of awareness rather than over-identifying, with them. And I think having a self-care plan, meditation, having a routine where we're going for a walk, where we are watching what we're eating, where we're able to stay in contact with other people, even if it is through virtual meetings or a phone call, where we're able to be in contact with nature, where we're able to take time to perhaps do something that we used to enjoy, a hobby or activity, or whether it's being in contact with spirituality. Whatever it is, it's something that works for you, it is individualized to you. And I think it's important to stick to that plan, and also include work and relationships in that plan. Be mindful of the amount of work that you can handle. Perhaps, write down your agenda for the day and divide it in small tasks. Rather than wanting to undertake too many projects at the same time.
I'm going to come back to Dr. Turman. We talked about, when to seek help. But, as this COVID-19 crisis wears on, Floridians of all ages who are uninsured or may otherwise not be able to afford or access mental health care now have a low-cost telehealth medicine option, and that is statewide through Miami's Albizu Clinic. There is no need for insurance at the Albizu Clinic. Rather, fees are based on the income-based sliding scale and delivered by Albizu University graduate students in both English and Spanish, either in person or online under the supervision of an Albizu licensed clinical psychologist. As I was coming back to you, Dr. Turman, I was thinking about, there's not just how I feel, but there's how the people around me might be dealing with COVID-19, burnout, compassion, all of these things that we're talking about, I have to take care of them as well. And, mental health has had a bad rep in the past. It's opening up now. But how do I take care of not only myself, finding the help, maybe at Albizu's clinic, but for those around me as well?
Okay. So that's a very good point. As was mentioned by the other panelists, there's a lot of things we can personally do to get a sense of normalcy and ease the impact of stress and environmental factors. But what about those that depend on us? At my clinic, we often see a lot of patients that have caregivers that are already experiencing the strain, fatigue, and stress related to caring someone who's ailing. Now we add to that all the factors that we discussed. And I want to point out as well that we, in mental health, we often see an increase when we approach the holidays as far as mental health problems such as depression, anxiety, and so forth. So typically around this time, we already know that there tends to be an increase. Now you add on to that everything else that's going on, it's going to present a lot of unexpected situations. But specifically looking at caregivers, I would say the first thing is to make sure you're caring for yourself. Often as caregivers, we only consider the person that we're caring for and neglect ourselves. So doing all the tips that the other panelists mentioned becomes very, very important, because if we don't care for ourselves, we're not going to be able to care for our loved ones. So that's very important. But what do we do when we have someone who's elderly, ailing, or even a child that we're responsible for? I think a main aspect is to try to maintain some level of normalcy for them as well. We know that social interaction has been significantly impacted by the pandemic and the restrictions, yet we have resources such as teleconferencing through multiple different formats. This is something that should be utilized and definitely implemented. Obviously, if we have someone who tends to be more elderly, facilitating this for them will become a major component as well. Making sure that we have resources readily available, numbers to doctors, make sure the medications are being monitored and we have plenty of. Here in South Florida, we recently had the tropical storm pass by, and at any point in time, there could be a natural disaster or even something going on that will hinder some of these resources from being readily attained. Providing reminders and explaining what's going on in an age-appropriate manner. And that goes both for the young ones as well as the elderly, and including those that have cognition compromise, such as individuals with traumatic brain injury or other neurological disorders. What we don't want to happen, as the other panelists mentioned, was for there to be an overarching sense of loss of control. That's what really causes pathology to arise, when we feel that we can't do anything about it. So ensuring those that we care for, that there is something that can be done, and structuring, as was mentioned by the other panelists, can be extremely helpful. But again, as caregivers, it's always important that before we think of the person we're caring for, we got to make sure that we're okay in order to take care of them. And resources such as the Albizu Clinic become very, very important, especially with the integration of telehealth, as able to reach patients and individuals that cannot venture outside the home or might not be able to come to the clinic.
You know, you made a good point, taking us, Dr. Scott Hyman, back to the top where we talked about it. Every year we see a lot of, public service announcements about seek help as we move into the holidays. There's the stress of the holidays. There's the stress of not having enough money. And now we've got the COVID-19 isolation on it. And yeah, we just had a storm blow through here, which is still upon us as I was driving in to get on this. Do you expect that this might be a worse time than ever, or with everything combined?
Worst time than ever. And I just feel like there's always some sort of unforeseen problem on the horizon. And I just sometimes think of my own history and kind of going through a review of my own life and all the things that have happened. And I remember, like, when I was a kid, I have small kids now, and they're in the midst of this COVID epidemic, and this is their major stressor. And my kids are preteen, and they're all walking around with a mask. And like Dr. Torgerman's saying, we're trying to keep a positive attitude, that this is just temporary, and hopefully, there's going to be medications coming around, on the horizon, and things. This won't be forever. I'm not one to say this is like the new normal. Maybe it's a new normal for now, but down the road, I'm pretty optimistic that I think we'll develop new treatments, we'll have vaccines, and this will be just one of those things we'll look back on and say, that was a tough time and we got through it. But going back, like, I was thinking about my own childhood. It was when HIV came out, and it was the AIDS epidemic, and I was up in New York City, and it was scary. People didn't know what this was about, and I talked to my kids about it when I was a kid. This is what the new thing was, and people were afraid to touch other people, and it was all this kind of people didn't understand it. And so, but we got through it, and now there's great treatments, and it's not even considered a terminal disease anymore. And then, later in life for me, was 9/11. That was the big thing, when, I was in my early 20s, and that changed the world. And that was a rough time then, and, all the changes that went along with that. And so, and here we are now. The next big problem we're dealing with is COVID. So I think, I don't know if it's necessarily helpful to kind of compare what's worse or what's better. It's just a matter of, what do we have coming? What can we do to get through it in the best way possible without sacrificing our sanity and not doing things that are going to make our situation worse. That's a big part of it too. Sometimes when we react to stressors and we react to problems based on how we feel in the moment, we oftentimes do things that can actually be pretty self-destructive. And oftentimes what people do, in my background, I've done a lot of work with addictions, is that people start to engage in addictive type behaviors, and it's an attempt to cope with the problem. People start drinking more, they start smoking more, they start eating more unhealthy foods because it helps them feel better. But, you know, it's not really the best way to cope, and it just makes things worse. So that's always something that, in my mind, is something to be very cognizant of. You know, how are we trying to cope, and how are we doing it in a way that actually might not be in our best interests, and what can we do to do things better?
You know, all of you have talked about young people, and I just wanted to make sure that the audience understood that Albizu's clinic for telehealth services include individual psychotherapy for children age 5 and up, couples and marriage therapy, family counseling, psychoeducational groups in specialized topic areas, including parenting skills training and psychology and diagnostic and psychoeducational evaluations for children, adolescents, and adults to determine special cognitive abilities and disorders. I was, hate to say it, I was so happy when when the school system opened up, so that I had one left at home, a 17-year-old, get out of the house. I could see it beginning to wear down on him. But I can imagine, Professor Lascano, this has got to be incredibly troubling time, especially for mental health professionals and human services in general. Is there a bit of a burden on them as well in terms of burnout and compassion fatigue and these sort of things?
Oh, yes, definitely. I mean, we're not only coping with the sense of our own situations in our personal lives, but also you're coping with changes in our line of work. You know, a lot of us had to learn how to use telehealth, you know, in working with our patients and engaging our patients or clients. And think about also those who work in hospital settings, even if they're not working directly with patients, just the fact that you're in a hospital environment, it brings a lot of stresses to their life. They're very worried about coming back home and what if they get infected and bring the virus into their family. So a lot of the healthcare workers are also working prolonged hours. As human services professionals, as Dr. Hyman mentioned, we have seen an increase in substance abuse. We have seen an increase in depression and anxiety. Just about, April through June, their survey, young people, we're looking at ages 18 to 24, and there was an increase in suicidal ideations. And suicide is one of those that we haven't been able to decrease throughout the past few decades. And unfortunately, with this pandemic we're seeing more and more cases of suicide and depression and anxiety. And unfortunately, many individuals do not prioritize mental health. And as you mentioned, some don't have health insurance, or those who have health insurance, oftentimes the co-payments for mental health are extremely expensive. So resources like we have in our in-house clinic are great for our community to have the opportunity to receive services like that. But I think it's extremely important for human services professionals, for those who are in the field, caring for others, that we monitor the symptoms of burnout and compassion fatigue. I think this should be even a course that we teach in undergraduate and in master's and doctoral levels for those in the human services program, because it all starts with taking care of ourselves where we are in optimal conditions to provide the services. I mean, being compassionate and empathetic, it's at the very core of being a human service professional.
I would imagine also, Dr. Sturman, as we move back to you, that this could be a very difficult time for people in the medical field with what they're facing each and every day. And I'll give you an example. I did have to have my sons tested and myself. And I went out to these testing sites, and there were all of these people there that were there day in and day out when we didn't know so much. It must be a very difficult time for them as well.
Yeah, I think the main thing to remember is that healthcare providers are people. We're human too, so we're susceptible to all the same factors. So it simply because we choose to be in the healthcare field doesn't make us immune to some of these stressors. So the same tips we talked about before very, very much apply to physicians, clinicians, and anyone else involved in healthcare. Obviously, those that are at the front of the front line will be the most exposed to these stressors, and things like PPE, protective equipment, and other factors come into play. Having the appropriate equipment to protect yourself, and then considering who else you may be exposing as you go home, and etc. So the same idea holds true, making sure that you do engage in these self-care techniques that we've discussed, make them part of a lifestyle, not so much just for the time, but incorporate them into your daily regimen. As was said by the other panelists, this will allow you to establish a level of resilience. As was stated before, even though this is a significant stressor that we're dealing with, and it's culminating with a lot of factors, it isn't the first time that we've dealt with such things. And Dr. Hyman alluded to back in the 80s, the HIV crisis, 9/11. It seems ever so often there's this event that results in generalized exposure to things such as a significant stressor. So building that resilience doesn't just mean dealing with it in the moment, but building up so should the next event occur, you have a better resilience to deal with it and it won't impact you as much. Healthcare providers being in the front line and dealing with this on an everyday basis do have more exposure, but if they implement the same principles we've been discussing, then they will also have that level of resilience that we're trying to express is very important for such times. So regardless of profession, at the end of the day, we're all susceptible because we're all human. We all experience these emotions and we're all engaging in this in one way or another together. So I think that that's important to take home.
So I'm going to stay with you, Dr. T, as we move back. One question for each one of you that I want to get to, and that is challenges to treatment. I mean, you've got people afraid to leave their houses. You've got people who are sick of being online. You've got people who are too elderly or too young to move into the different treatment arenas, or they're just sick of it. What are the challenges to treatment these days?
Well, the main one is we all know that face-to-face interaction is most desirable. So as a precaution to everything that's going on, a lot of our interactions are through telehealth. I mean, me personally, the majority of my patients are seen through this medium across a computer screen. And as a professor, this is how I interact with my students now. So again, I think the starting point is to know that it's normal to have a stress reaction to this. And I agree with what was stated before. We shouldn't just believe this to be the new normal, but something we're adjusting to. To a certain extent, certain things won't necessarily be the same, but it doesn't all have to be a negative. I think part of the growth that comes from this is the integration of technology, and we will get better at it. And it'll be something that doesn't seem like it's just placed onto us, but integrated in both our occupational, academic, and daily lives. But I would say that would be the main hindrance, is that notion that face-to-face interaction, especially as clinical psychologists, as mental health professionals, we rely so much on that interaction, because it isn't just what someone is telling you or reporting as symptomatology, but it's how they're doing it. And all these other aspects of communication that to a certain degree are, I don't want to say lost, but definitely attenuated by this medium. The fear of contracting the disease. Obviously, there's varying opinions on the lethality of the virus, but with both extremes being present, this leads to different reactions, and that's something we do have to contend with. So we have to, as clinicians, make sure we're protecting our patients, but also protecting ourselves. So when we do encounter face-to-face interactions, we have to make sure that that's taken into consideration. But I would say that's the main challenge, integrating technology into our daily lives. But I always believe that the best way to deal with challenges is to resonate, to basically roll with the waves, rather than trying to battle against them. That's oftentimes when we see the most pathology come up and the most difficulties arise, when we try to go against the trend of what's going on rather than incorporate it. And places like the Albizu Clinic and other community centers are doing this in order to better serve the populations that are very much in need.
Okay. Professor Lascano, your thoughts on what are the challenges to treatment?
As Dr. Torgerman was mentioning, I think it has to do with all of us adjusting to, doing therapy through, telehealth and engaging our clients. In my particular case, I work with the young ones. So especially when you're working with a young child with disabilities, a child who might be in the spectrum or have, it's diagnosed with ADHD, oftentimes we have to adjust to having the parent there at all times and doing more of a family therapy via, telehealth, to be able to engage the family, a lot of coaching and a lot of, parenting tips to help them, navigate the issues they're having within their own family. And especially, one of the issues that keep coming up in therapy is with school, difficulties kids, especially kids who have disabilities, being able to stay engaged in online classes. And helping parents to vent and process these stressors. So it's been one of the challenges. And for us, from technologists, a lot of practice, and at this point feeling more comfortable. And like the other panelists said, it's a matter of embracing this opportunity for our own personal and professional growth in terms of feeling, comfortable utilizing this technology to be able to engage, which is our ultimate goal, is to engage families and providing the help they need.
Hey, Dr. Hyman, what do you think?
Yeah, I would echo everything that everybody else said in terms of the external barriers, which, can get in the way of people, getting to treatment, which, telehealth has improved, but there also are some downsides that go along with that, that there's a piece of this that gets lost, kind of like that, like Dr. Torgerman was saying, that face-to-face interaction. But I also think another piece to this that really is something I have given a lot of thought to is the internal barriers to people getting to treatment, such as the stigma that goes along with mental health treatment. People are afraid that, well, what does this mean about me? This means that I'm weak or defective in some way. And it really doesn't mean that at all. Or, people feeling ambivalent about treatment and, unsure of whether they really even want to do this or not. So people can struggle with a level of like ambivalence and whether they even want to do this, and fears that go along with engaging in treatment, and all the things that internally can get in the way. And I think the last thing that is a potential barrier to treatment is that I don't think a lot of people really understand what we do. I think sometimes people think that therapy is what they've seen in terms of pop culture and on TV, where somebody's laying on a couch and being analyzed for years and years and talking about past events. And really a lot of what we do is very brief. We do a lot of work. If there's a type of psychotherapist, type of psychology called cognitive behavioral psychology. And really that's more about helping people think about what they can do now to help them achieve their goals in the near future. And it's about learning new skills that a lot of people haven't learned, or improving upon skills. It has to do with helping people that maybe have learned skills, but for whatever reason, their anxiety or their mood state is impairing their ability to perform well because of the stress that they're under. So at work, for example, maybe they know what to do, but for whatever reason, their anxiety is so high that it's affecting their performance at work. And a lot of the work we do is with some of what I was saying before, which is how do you help people, or how can people learn to change those disruptive thinking patterns that can get in their own way of achieving their goals and helping them feel better. So a lot of work we do is to try to help people not necessarily think positive thoughts. It's not about that. It's about trying to be more rational in the way we're thinking. It's about trying to evaluate situations in a less biased way. It's about learning new strategies to kind of work with that, negative self-talk that we all have. And I think that's important, that we all have it. And sometimes people think, well, is there something wrong with me that I'm thinking these things? Well, we all can tend to, think negatively when we're faced with a stressful situation. It's just that some people tend to do it more than others, and it starts to be more disruptive to them, and it starts to affect their lives in negative ways. And then other people just, like I was saying before, in terms of they start getting involved with addictions and whatnot. So, even if you have a family member that you can go with, or if you notice somebody in your family and say, hey, why don't we go talk to somebody? Let's go together. I think it'll be good for the family. And you don't even necessarily have to bring up a particular problem because it's probably going to come up anyway. But at least you get them in there and it opens up an avenue to discuss whatever it is they're struggling with or whatever it is that's overwhelming them. And hopefully they get some relief where that becomes reinforcing and they want to continue the process.
I'm going to stick with you, Doctor. I know you are the author of 28 publications related to your understanding of the links between stress, coping styles, cravings, and the course of addictive disorders. We have some questions now from our audience, and one of them has to do with bad habits that you're talking about. How do you recognize a bad habit, and how do you know when to stop a bad habit before it gets out of control?
I think people can start to recognize that they're relying on a particular substance, whether it's, smoking, drinking, if they're drinking to the point, for example, that, it's again affecting their life in some way. A lot of people can drink moderately. For women, moderate drinking is thought of as like 1 drink a day. Men, it could be 1 to 2 drinks a day maximum. But it's when people start to, drink to a point where, for men, there's definitions of binge drinking, which is about, for women, it's about, I think it's 4 drinks within 2 hours time. Men, it's 5 drinks within 2 hours time. So, those type of drinking patterns, heavy drinking, it starts to affect the person's ability to wake up in the morning, go to work, function the next day, or even that day, it starts to, start to affect their relationships in some way because of their drinking. They're getting into more arguments, or, they, of course, the big one that oftentimes gets people into treatment is they get arrested for something like drunk driving. God forbid, it leads to a major problem where you really hurt somebody or hurt yourself. So, when you start seeing, I think like anything that we consider a disorder or a behavior that becomes problematic, it's like, is this starting to affect other aspects of your life, your relationships, schoolwork, your ability to function at work? Is it leading to legal problems, or are you doing this behavior in a way that is contributing to other health problems? So, for example, oftentimes people, like I said earlier, are eating much more unhealthy foods. They're eating a lot more, high salt, high sugar, high fatty foods, and their combination, which seems to be doing something in our brains that are very rewarding. And so, people don't do these things because they don't do it just for the hell of it. They get something out of it. The problem is, again, they get something out of it in the short term, but when they rely on that type of behavior and they engage in that behavior too frequently, it leads to weight gain and all the health problems that go along with that. So when people start recognizing, I'm gaining more weight, I don't feel as much energy, I feel like I'm just eating all these things, and it's just not, I just don't feel right about myself. It's affecting my sleep, it's affecting my ability to, function at work or whatnot. And they, again, like the number one thing, of course, with the eating habits is, is weight gain and all that goes along with that. So, I think just to kind of be aware of these things as much as possible, listen to family members. If somebody expresses concern about you, there's probably a reason for that, and you might want to just think a little bit more about it and, try to keep some of these habits to a minimum. I mean, there's things you can do to try to help with that in terms of setting up your environment in such a way, keeping these things out of the house, make it easier for you to get the healthy stuff and harder to get the unhealthy stuff. You could still go out and get it, but it's harder to get it. So in that moment, if you're feeling like a craving for something and it's not there in front of you, but something healthy is there in front of you, you might be more likely to eat that healthy thing than the unhealthy thing. If the alcohol is not there in front of you, you might be less likely to eat it or drink it when you're in that state that I'm starting to think, hey, I really want to drink right now. So those are some things to think about.
Here's a question that's really a sign of the times. I want to go to it anyway. When a member of your household or friend doesn't agree with COVID-19 safety protocols, how do you deal with it? Dr. T, you want to jump at that?
So when someone in your household doesn't abide by the safety precautions, that's a difficult one, because for some people that is a political argument. So again, as I stated before, it's about trying to resonate with the individuals. In our program, we teach the techniques of motivational interviewing as a means to help people go about change and other aspects. And sometimes I even find myself integrating this outside of not just my professional practice, but my personal life, and because these techniques do hold true. When someone has an opposing opinion, a lot of times we want to immediately express our notion and kind of go about it in a way to either express to them that they're wrong or simply just convince them. And that really doesn't work. So when someone doesn't abide by these restrictions, or I would say these safety measures, it's good to find out why they're doing this. Now, obviously, protecting ourselves is paramount. So if someone in your household isn't abiding by that, then you yourself have to set the structure to protect yourself. And if we're talking about someone that you may be responsible for, such as children, elderly that may also be exposed to these habits, then that becomes a serious consideration. But as far as approaching someone like that, I would go at why is it that they're not abiding by that, and try to understand the decision-making process a little bit better rather than just overtly challenging it. Meanwhile, taking the measures to ensure your safety within that environment. So for some people who share a household with someone that may not abide by these safety precautions, it may mean walking around with a mask in your own household, sectioning areas of the household so it minimizes interaction, and then making sure that if you are a caregiver for children, elderly, or someone who's compromised, making sure that you are overseeing and monitoring their contact with this individual. But as far as how to deal with the individual directly, I go to my professional experience as far as when I encounter a patient who may be a little bit resistant to intervention or to the treatment provided, and seeing where I can meet them where they're at, trying to understand what's going on behind what they're saying that's leading them to go against something that otherwise could negatively impact them. So that would be my approach, but definitely a question of the times in regards to having households that become quite divided on regards to how to deal with this virus. I mean, there's individuals that deny its existence and describe it as a hoax, while there's others that categorize it as the worst pandemic that's ever stricken humankind. So we use absolute methods of belief when it's hard to establish structure in the middle, meaning we don't like ambiguity. We don't like things to look like they don't make sense or they don't fit into our schemas. So sometimes we place them on there, even if they don't necessarily fit. And this is a way to protect ourselves and make the environment more predictable. If we try to understand that when we interact with others, then we'll kind of see where people are coming from. And I allude to what's been said before by the panelists. When negative behaviors arise, they arise for a reason. They serve a purpose. So as clinicians, we often try to find a productive substitute behavior that can still meet what the patient is trying to attain with the negative behavior, and then understand a little bit more of the contingency. What's keeping this behavior going? The same thing with these thought patterns that can potentially put others at risk. So that's how I would go about it. But I would say try to understand those that have conflicting opinions rather than directly try to negate them as a means to try to get to some level of resolution. But don't forget to protect yourself or anyone else you're responsible for. I think that that's also important to mention.
Very good. Professor Lizcano, I want to jump over to another question from what I think is, relevant here in South Florida for sure. First of all, they want to thank all the panelists for all of the information and discussing this, and for Albizu for hosting this. And they said you guys are live on their Facebook. What do they call that? The Facebook Live, as they're using this as a watch party. But they did ask a question. Some cultures do not believe in mental health. How can we reach out to these communities and educate them? Professor Lizcano?
Yes, and I love you ask the question, because when we are campaigning for mental health awareness, one of the things that we have to keep into consideration is culture, and how culture is such a huge impact when it comes to, from the way we see what mental health is, from the way that we're gonna look for services, how we're gonna acknowledge feedback from other people when it comes to perhaps the need to seek mental health services for ourselves or loved one, or even in the way that we internalize or we realize that we might be going through a mental health challenge. So culture is such a huge impact when it comes to that. Think about, for example, in societies, for example, individualistic societies where perhaps the individual is just focusing on themselves, rather than getting in other collectivistic societies where the whole family is involved and the whole family perhaps either is contributing to the problem or supporting the individual to seek services. So it's really important to keep the cultural aspect involved. So many cultures, for example, cultures such as Hispanics, Asians, Afro-Americans, they see mental health challenges as a sign of weakness, as a sign of being unfit. And especially if we look into genders, even more so when we look at men and the way they, certain cultures like the one I mentioned, they view mental challenges. So we have to take all that into consideration in the way in which we provide information to the general public into how common is mental health. Actually, mental health challenges are more common than lung cancer, than cardiac issues, and diabetes, for example. And we tend to pay more attention to these physical or medical issues more than mental health challenges. So when we're able to provide this information to the public and we're able to understand the characteristics of the culture, so we can really customize how we're going to approach them into enticing them to the importance of seeking mental health services, I think that would make a huge difference. Especially when it comes to addressing the stigma around mental health.
Dr. Hyman, your thoughts?
I mean, I don't know if I can add much more to that in terms of, culturally, but I think for many groups, like Dr. Lestano was saying, is really to have that social network, to have, the ability to also engage people that might be more comfortable even going to a spiritual place, to maybe be that kind of first step, and to, use the church or the synagogue, mosque, anything that where you might find some great advice and, a group of people that can, help you through a situation, and really trying to encourage people even to, use for them what might be helpful, regardless of the avenue to change. If a person finds being spiritual or seeking religious comfort helpful, by all means, encourage it. So for some people who might be afraid or concerned about going to a mental health professional, maybe trying to even encourage them to go to one of these other avenues might be helpful. So again, it kind of depends on the particular culture and what they value and where they seek and where they find help. And you want to try to match them where they are.
We've got a few more minutes. Your point is well made with Albizu's clinic, low-cost clinic, bilingual. They're culturally in tune. Counseling can be highly effective in helping people cope with successfully with stressors of their COVID-racked world. And as the holidays come up, I wanted to take a few minutes to get to a question that I think you guys have alluded to part of it, and that is there are a lot of people whose financial outlook has been impacted. They've lost jobs. Their kids see them sitting around the house or struggling to find work, to find money, and they're just not feeling very good about themselves. As we move into the holidays now, they might not be able to afford Christmas presents. They may be in food lines. These are very real factors that a lot of people, lots of people are dealing with. What would you say to that person, besides, possibly seeking some help professionally? about how to deal with this lack of worth because of the loss of job, if I can say it that way.
I think it's safe to say that, we're living through unprecedented times. I mean, I don't think we ever experienced, going through the holidays in the middle of the pandemic. And of course, adjusting to what our situation is right now. So if we don't have a job and we're struggling financially, it all goes to the mindset in which we are approaching the holidays. So we cannot have the same expectations to celebrate the same way we used to celebrate. We have to adjust it to our means. So perhaps this is the time where we can build new traditions, be thankful for what we have, focus on the positive, perhaps develop even a new tradition or memories, build memories that will last into traditions. So for example, could be like with the kids, creating some sort of a gift. It could be a painting, or it could be something in arts and crafts that we could, take into consideration what the other family members, how they will like it. So I think it's a matter of adjusting, to the times in which we're living and approaching with that mindset, like Dr. Hyman said before. This is not something that we're going to look at, something's going to last forever. This year, we are doing things differently, and next year will be hopefully, and perhaps new memories will come out, like will become, traditions. We never know.
Dr. T, we've got a couple of minutes left.
Okay, so I think that's, I'm going to go off of what was just stated, the notion that redefining what the holidays means is very, very important. Oftentimes we look at the holiday season as the purchasing season, and our identity is founded on how much purchasing power we have. The reality is that most of the population that shares this beautiful planet with us doesn't have this typical purchasing power that becomes popularized for the holiday season. So oftentimes we see the surge in mental health issues because of the incongruence between where we see ourselves and where we think we should be. And this time is no different than that. I do believe that everything that's happened this year, 2020, has a uniqueness to it. We can't deny that, but it's how we approach it that has to set the tone. And if we establish a perspective where we can derive some positivity from everything that's come from it, then we can build that resilience we were talking about before. And part of that is our value system, looking at things like our loved ones and everyday life and placing new value on things that a lot of times we take for granted because they're so readily accessible. Look how difficult it's been to establish normalcy as far as how to interact with others. Yet since it was so readily accessible before, we didn't really think about it. Maybe calling loved ones that we haven't talked to in a long time, maybe doing an art or craft project, maybe initializing an herb garden. There's a myriad of ways that oftentimes we don't think about because we become part of this cycle that just keeps getting perpetuated day to day. And now we've had a little bit of a pause. So I think introspection is important, and kind of going full circle with what was asked before as far as mental health and the different perspectives from cultures. I think that what we're doing now is how you elicit change, like getting into a discussion and expressing information. Something as simple as simply washing your hands doesn't only reduce the incidence of COVID-19, but other diseases out there have almost been eradicated simply by people starting to wash their hands more frequently. Yet something so simple oftentimes is not utilized. And we look at things oftentimes thinking, we need the most complex, the most technologically advanced solution, when something as simple as just expressing your thoughts and conveying this to someone else can provide significant improvement. So I think getting into this dialogue and talking about the resources that are available and the notion that mental health issues are common and it is expected to experience some level of stress response to what's going on, I think that that's important too. So I think bringing it all together is a good way to communicate. So I guess that's my way of answering that question.
Good. Dr. Hyman, we got about 30 seconds. You want to wrap it up for us?
I think overall, like I think some people were saying already, is we need to show ourselves a little compassion, be a little bit forgiving with each other. You know, if we're not going to have everybody over like we used to in past years, and getting through these holidays with all the gifts, like Dr. Torjaman was saying, and help each other out as much as possible. If you're really struggling, I'm talking about, like you were saying, asking about people that really are, they've lost their jobs and they're really struggling. You know, people that are faced with unemployment. I mean, those are real challenges, and you know, that's a point where it's trouble versus, you know, it's not just threat. They're in trouble, and that's a tough situation. That's where you really need to, I think, reach out. You know, try to you know, if you are struggling and you're even homeless, I'm thinking, you know, we have this homeless shelter, there's Camilla's house. I mean, there's places where you might be able to get more of that information about how to get those basic needs met. This is also an opportunity, I think, you know, to revamp your resume. I've sat down with people and just kind of helped them with cover letters and their resume. There's nothing wrong with that. You know, anything that can help you learn how to navigate these online job portals to try to find some way of getting some new position or income. But I mean, those are the toughest situations. Those problems are real. Those are real problems.
Thank you, guys. Thank you for all of our panelists. Dr. Hyman, Professor Lascano, Dr. Torgerman, thank you also again so much for sharing your expertise and this important information. I can tell by the questions being asked that there was an audience out there that really needed to hear this and wanted to hear this. And we also want to thank everyone who was logged in and participated. Again, my name is Edwin Odell. Thank you for allowing me to be with you. Good afternoon and stay safe.